Now I invite Dr. Mahesh for his talk on 10 classic verdicts that every ophthalmologist should know. Dr. Mahesh.
Thank you, Ashok. I will be speaking about some of the verdicts that all of us should know. Why we should know? When we talk about ophthalmology, we talk about studies. We talk about research and studies, and we quote that everywhere. Anchor study, Marina study, this study, that study. Based on that, we do this. So, like that, in law also, there is something called verdicts of highest court, like Supreme Court and High Court and everything. So, which is binding to other courts also. So, that is why we should know some of the verdicts, and then based on that, we can always argue in our favor. So, this is called judge-made law. Unfortunately, nothing much is there in the constitution or law regarding the medical negligences. So, it is called judge-made law or stare decisis. So, what that means is, if the Supreme Court gives a verdict, that is binding. That can be quoted by us in the lower court to defend us. So, it is based on Article 141 and 142. Whatever the Supreme Court says will be binding to the lower court. So, it is called judge-made law, depending on individual cases. So, this is as good as a law, if we can quote it properly. So, what we do, PubMed search, like that we can do literature search from probably. There are different things, I think. I use India Kanun, very easy. And search words. For example, I put endophthalmitis and medical legal. I get 1,500 citations. Full verdict. You will get the full verdict of all the details. So, in that you can probably choose, like in PubMed we give specific topics. Like, so we limited the search by High Court and Supreme Court verdicts, then you will get only that. And you can use that, go through that and defend yourself in your case. So, few things that I have to tell you is starting from Bolam test. Okay, this is not Indian court, but Bolam test is the one that is being applied across India in medical negligences. What is Bolam test? In 1957, there was a case between Bolam versus Fry and Barnett Hospital Management. I think they had a spinal injury following a cyst removal, and patient had a paralysis or something. But they took evidence from the other doctors, and they said all of us will do the same thing. So this is a rare complication. So he was let off. The doctor was let off, and this remains the principal test to assess standard of care. So in Bolam test, there should be a normal practice guideline. That is, for example, we manage endophthalmitis. There is a standard guideline. And secondly, it has to be proven that defender has not adopted that practice. That means you have not given intravitreal injection, you have not given something else. Third, that the doctor has taken a path which no doctor will actually take. That is, probably you have not attended the patient for 2 days, 3 days. So these three things are part of testing, applying Bolam test in your case. So like this, I told you, AC tap, intravitreal injection, vitrectomy, systemic, all these things are part of the standard of care. Suppose the doctor has not attended, or doctor has given a not given intravitreal injection or something like that, or doctor has thought that it is a inflammation and given only steroids, something like that. So these things will go against the standard of care. Now, second one, already discussed, criminal proceedings against the doctors are usually difficult to take except in death, which is quite rare in our cases, but we do have. There are a lot of cases where death has happened after general anesthesia complications in ophthal setup also. Usually the court says there should be a mens rea, that is a guilty mind should be there when you charge a criminal negligence. So no doctor will ever think about screwing their patient's eye. So there is no criminal negligence in any of these cases. So in death, this comes to play. So in Jacob Matthew versus State of Punjab, which is quoted everywhere, because that case has defined what is medical negligence and what should be the requisites for charging criminal negligence, like severe disdain or druglessness, drugless disregard for the safety of others. This should be there. But is it that what is happening now? For example, real life scenarios in a death or a cluster endophthalmitis, there are different factors working here. Here are the police, politicians, and media. I call it the dirty three. They can charge they can go out of the way to trouble you and causes considerable pain to the healthcare providers. Probably Bharatiya Nyaya Samhita may have some other things I have not gone through. Ashok was telling it is not something great beyond IPC. So anyway, the police can arrest you based on the complaints, and media can come and if you are arrested on a Friday night, you will be there at least for 48 hours within the police station before getting bail. So these things are happening. Even there was a suicide of a lady, Archana, in Rajasthan after the death of a gynecologist. So these things are happening because the politicians and media play a dirty role in these cases. So what is, ultimately nothing will happen in the court of law, but the pain that gives in this real life scenario is very difficult. Now regarding consent, very important. This Samira Kohli versus Prabha Manchanda case in 2008 has defined what should be the consent. It should be a legally valid consent, not there are different types of consent. In UK, it is real consent. In US, it is informed consent, where everything should be mentioned. It should be like a book. In India, it is called legally valid consent given by the person. Expressed, that is, actually, ideally, it should be written by the patient freely and voluntarily without fear, signed by doctor, patient, and witnesses. And ideally, it should be written in patient's own handwriting. None of us do that. We take something called blanket consent. Ideally, the consent is the major source of losing a medical legal case. This study was done from Korea. In fact, they took all the medical legal cases that they lost, and it was mentioned that more than 50%, more than half the cases were decided in favor of the plaintiff due to the violation of informed consent. That is the importance of informed consent. AIOS has brought out informed consent booklet that all of us can customize. I am again telling, don't copy and just paste. You can customize it based on your this thing. This covers everything. You may not need everything in your scenario, so you can customize in your own language. And you should make the patient right at the end of the consent. I have understood in local language. I have read and understood. That one line at least should be there, because it is very difficult for them to write the whole thing again. So that is regarding consent. And one more thing in that that I will come to. CAM cases they also need consent. It is not blanket consent. That is not blanket consent like filling the blanks. No, it is not at all valid. There are plenty of cases across India where the court has mentioned blanket consent is not valid. Going back to the fourth verdict, that is off-label medications. We use a lot of off-label medications, triamcinolone, TPA, antibiotics, various intravital antibiotics. These are all not ideally made for ophthalmic use. But Avastin has been used over the last few years, and there are cases for and against Avastin. I mean, for and against doctors in the Avastin cases. For example, this case in 2019, post-Avastin endophthalmitis, and they applied Bolam test, and all the management was proper. That immediate management, everything was proper. So court concurred no negligence. But in the other case in 2018. This case, Telangana State Consumer Redressal Forum has clearly mentioned that the use of off-label medicines in India. In India, it is illegal to use any drugs for anything else other than what it has been approved by DCGI. Now, this is important judgment, and the scenario 5-6 years back was little different from the scenario now. When there is no other alternative, you can use, because you have to use. Like intravitreal antibiotics in endophthalmitis. Nobody has made an antibiotic only for intravitreal injection. It is all parenteral use only, vancomycin, ceftazid. So you can use. But now this has to be taken care of when we use Avastin. So VRSA, AOS guidelines are there, uniform consent, all this. And here there is an important point which is different from the last 5 years back when the Avastin ban and all these things were happening. There are alternatives to Avastin which are approved. Okay, now biosimilars are there which are approved for the condition, which are cheap enough. So at present it is little dangerous. I am not telling don't use Avastin, but it is little dangerous on a medical legal point of view to use Avastin. So learnings, these are the learnings from this case. Now, ROP, the case 5 is ROP, already discussed, Krishnamar versus State of Tamil Nadu. It was a badly contested case from beginning and probably due to the inefficient state machinery, and they had to give a compensation of 1.38 crores. So learnings from the case, be aware of the latest guidelines. What is the ROP guidelines? Here nobody has given a case, because I didn't get vision, it is because they didn't screen in time, it was not detected. That is the medical negligence. Not after your laser or vitreous surgery, they have not got vision. You have tried maximum, that is the result. So never miss a screening, proper screening in ROP. And the another important point here, again I am coming, is government doctors are not immune to CPA. ROP babies, already Ashok mentioned, ROP babies can sue even after 18 years. So law of limitation is applied after 18 years. Up to 21 years they can sue. So these things are important in learnings from this. Compensation already Dr. Anand has. Now coming to CAM surgeries. This is one case where it was in 2012. Basically, the patient had got an endophthalmitis. And the court very clearly said CAM does not mean compensation can be reduced, because ideally free treatment means free for everyone and everything in the hospital. That means suppose you do CAM cases for 30 cases and you charge little from one patient, you charge 4 in IOL, you charge little, or even registration in the hospital, you charge something. Why in government hospital it is, they come under CPA? Because they charge 10 rupees for a registration in the OPD. It is not free treatment. So complete free treatment only is exempt from the Consumer Protection Act. So don't think that CAMP is not, it also comes under this. So that is one point that I wanted to. Then the next point is case number 7. Bad outcome are not doctor's fault if managed properly. This is an important message. Like this case, Supreme Court has told that after sterilization, sometimes it fails. So it is doctors is not at fault, because the failure rate is almost there. So when you give a consent, you can mention the rare complications of 5%, 2%, endophthalmitis, all these things. So you have told the patient. So this is important. The bad outcome is not. These are some of the points that we can use for defending ourselves. Like this, another, Sachin Tyagi versus National Consumer Redressal Forum. There was a scleral melt after cataract surgery. Who can predict scleral melt? It is an immunological thing. He has done everything in possible with consultation, other cross consultations, everything. And Consumer Court finally said, this is a rare complication, and he has done everything possible. So they ruled out. Unrealistic demand for compensation should not be allowed. This is another verdict from National Consumer Redressal Forum. In fact, I was talking to, this is a Saini versus Center for Sight. The patient asked for 6 crores on various grounds, including this is a refractive surgery, and that is another problem now a lot of people are facing. So they asked 6 crores plus for related to treatment, loss of earnings, future medical expense, damage for pain, suffering, loss of marriage prospects, etc., etc. So ultimately, the court concluded that the claims for compensations were exaggerated and lacked basis. And there is an increasing tendency among complainants to overvalue their claims in consumer. So they just dismissed it and asked the patient, if you want, you can go to the lower court and apply for a smaller amount. So that is what. So these are some of the interesting cases that has come over the last few years. Differences in opinion among doctors is not negligence. That is another important thing. Suppose I treat a patient based on Okay, Dr. Ashok will explain probably that if there is a case of CSCR with X-rative RD, it may be mistaken for VKH sometimes because the findings are and the treatment is opposite. So there could be like Kusum Sharma versus Batra Hospital. There was a case. In that, the court has clearly mentioned there could be a difference of opinion in the differential diagnosis and management protocol. So it doesn't mean that doctor is negligent. And medical professionals should not be unnecessarily harassed or humiliated so that they can perform the professional duties without fear. So this verdict also we can use whenever we need. This is a Supreme Court judgment. End of ophthalmitis, the last but not the least, it is the biggest nightmare we can have, because this is the only place where it is little difficult to defend ourselves. Because if you get a cluster endophthalmitis, there was a session by Vision 2020 yesterday, cluster endophthalmitis, even though it is from the fluid, only the doctor is taken, the fluid I use, ringer lactate I used from one company, they are not there in the picture, only the doctor is charged. So there are different cases. And in fact, I searched in the endophthalmitis cases, I got around 50 cases from the Supreme Court level, National Consumer Redressal. 98% of cases are in favor of doctors. Only 2% are lost because of something happening wrong in the documentation or something like that, or mismanagement or delay in treatment like that. So this is the good news that all of us should think about, that 98% of endophthalmitis court in Supreme Court is in favor of, even though the lower court might have said differently. So like this is a case, National Consumer Redressal Forum, and they mentions that this is an inherent risk associated with cataract surgery and the management is okay, so they let the doctor go. And this is another case. This is a postoperative, if the postoperative care is standard, there is no point in penalizing the doctor. But there is other extreme also where the court has gone against the doctor. Like this case was there. The patient was kept without doing any intravitreal or anything for 3 days, and then patient was referred. So that delay in referral of 3 days created and it was awarded against the doctor. So this is one thing. Like another one, diabetes control in before cataract surgery. The doctor knew that the diabetes was there, but he never bothered to check it or control it. This is a little controversial. What is the ideal guideline? There is nothing like that. But even there was no checking of sugar, blood sugar or anything. So it was against the doctor. So this is another one. Actual vision was not recorded. Findings were not recorded. Because of all these things, there was a compensation of 1 lakh against the doctor. So in endophthalmitis, it can go either way. But 98% are in favor of doctors. So with that, these are around 10 verdicts that I took from the site, and probably some of them may be useful when you defend yourself in the court of law. We have 15 more minutes. Any questions? We are ready to discuss. Thank you.
One comment, okay. You can use the mics.
In case of probable fungal endophthalmitis, the patient may have diminution of vision after 3 weeks or so. So, how the doctor who has given good vision or reasonably good vision for the 2 weeks or 3 weeks post-op can be held liable?
It is from the time of diagnosis of endoph. Like, after 3 weeks he comes with endoph. Immediately after diagnosis, you have to take appropriate treatment.
What he is asking is whether we can defend it because it is from some...
The patient post-operatively was okay.
Yeah.
For about nearly up to 3 weeks, the
no
patient didn't complain any diminution of vision. After 3 weeks, there was a complaint of diminution of vision, and it may be referred to some other places, and ultimately the eye may or may not be lost. It is not known to the primary operating doctor. But in these cases, how the primary operating doctor can be held liable in the case.
Okay, your defenses, I will tell you. One, this has come after 3 weeks. So it might have been, you can give all the, when you defend yourself, when you can give all that sterilization protocols, other people done in that time, none of them had got any endophthalmitis. The record of all the other people, and if you have a standard theater protocols like NABH, all this can be submitted to the court at the initial stage itself, saying that this has not come from myself. This is for defending, I am telling you. The number 2 is, once you diagnose it, whether you have instituted proper intravitreal AC tap, that is the second part of management of the complication. Okay, so these two.
No,
Yeah.
in most of the doctors who are not very conversant with the posterior segment
Yeah.
formalities, they refer the case to some
Exactly,
other
fine,
vitreoretinal
that is
surgeon.
enough, that is enough.
So the primary doctor just referred the case with suspicion of something for vitreoretinal checkup and do the needful. In these cases, the patient may not go to the doctor.
That is his, then that is
The patient may go to the doctor after unreasonable delay, or that doctor may not be doing something good, or even the doctor has done as per protocol, the outcome may not be good.
Yeah, I know.
Say after one year or 6 months, the patient files a case against the primary doctor only.
Agree, sir. Actually, in this case, it is very easy to defend your case. If I was your lawyer, I can easily defend. All these points can be used.
Huh,
Because
just-
It should be documented that you have referred on the proper time.
anybody can give any case for anything.
Yes.
So, because
The
here,
right of the patient
but,
to give a case.
you will not lose the case.
Huh.
That is for sure.
The
if
thing is
properly.
that on the first instance, where there was a doubt that something may occur in the posterior segment, and I am not conversant very well and confident to tackle in my
No, then it doesn't become your liability because you
Yeah.
have already referred, no, so you don't have to worry.
Huh.
And a person can give a case against anybody. You cannot prevent somebody from giving a case. When a case
So
comes,
if
you
there
have to
is-
prove yourself and get out of it. That is it.
if the referral note is there,
Yeah.
the primary doctor is saved.
Yeah, it is saved actually. If you have all the other
Documentation and everything, you are
of
saved.
all these things, that you are, that is very difficult. I told you, 98% of endo properly managed. Here the proper management is you have referred immediately on the suspicion of an endophthalmitis because there is no facility in it. That is enough. That is enough. You have immediately.
The
Whether you have
complications
gone-
can happen to anybody, but it should be properly managed. If you can document that, that is enough.
In many cases, the patient doesn't come to the follow-up at proper time.
Exactly.
Or
That-
designated time, number 1. Number 2, I have seen so many patients at their residence, they use very unhygienic atmosphere and put the drops anywhere on the table and instead of the 4 times or 8 times, they put once. So how this thing can be proved in court, that the patient himself is careless?
Yeah, your only defense is what you have recorded. Suppose patient did not come for a follow-up 1 week later and he has come after 2-3 weeks. Just record it. Patient has not come for follow-up in spite of this thing. That record is enough for you to save you. Okay, so that is.
Acha. In some instances, there are some doctors who send their assistant to the nearby patients at their residence for the dressing at their residence after one day or 2 or 3 days consecutively. Is it
it is not.
accepted by law?
It is not accepted.
Very
If there is an
difficult to
endophthalmitis, it is not accepted.
No.
It will be, doctor will be held liable because he has to see the patient next day. He has not seen. That is negligence, no?
Oh, the
Yeah,
next.
now, this goes to court. Let us imagine that this has gone to the court. The court will ask an expert opinion. For example, the head of the department of medical college or RP center, somebody will be called. And they will ask, what is the standard of practice? Whether you will see the patient next day. And the expert opinion will be that we have to see the next day, right? So if somebody has gone into the house for dressing after 3 days, you cannot stand. You will lose.
You lose.
So that is the importance of
Following protocols.
following
So
standard
for
protocol.
for the daycare cataract surgery,
Yeah.
they don't come to the hospital or
No, that
the-
is what I said. No, we have to record. we have to record and make sure that it's a patient's fault and that can be said. That is all. Sir, you have front door.
It's on.
We have taken all the care for pre-operative assessments, patient is stable, cardiac-wise, everything. And MI happens, on table. Once in a while, this scenario happens. And the anesthetist is not always there, especially with, those topical cataracts. And we don't need anybody else than our trained staff of us. Now, we are not good enough to manage that case there and then on the table. If something bad happens, if the patient can't revive the patient and, the most unwanted of the things happen, where does the doctor's responsibility stand in these cases, sir?
Actually, the doctor will be held liable because at least, if you are you have to keep an anesthetist and at least the basic care you are supposed to give so that the patient at least can be shifted to a hospital where he can get an expert care.
Sir, this has happened in our hospital at least 2 or 3 times. There was death on table after cataract surgery. There was an anesthetist who tried everything, gave all these things and recorded, and then even intubated and shifted the patient to the nearest super specialty hospital with no time. But if you don't have an anesthetist,
that is the
it
thing,
is little
sir.
difficult to this thing. I agree.
And these days, getting anesthetist as standby is a thing, sir. Like especially in standalone hospitals, where you just basically are a cataract surgeon and that's all you do. 2, 3, 4 surgeries. The anesthetist is almost never ever available. And if it's a complicated case, we definitely want somebody to be there. But the routine ones, it's not there. And this scenario happens once in a while, sir.
It's better to have an anesthetist.
This has happened even in bigger hospitals where there is a death and it's very difficult to defend in spite of having everything. So if there is no anesthetist, it will be difficult to defend, sir.
Yeah. Okay.
And now we are talking about the Bolam test where, suppose you do some procedures, some standard of care you follow, and some other doctor comes and says that this is what I also do. So that means according to Bolam test, the court will feel that is a standard of care. But now we are going from Bolam to Bolito's test. There is something called as the Bolito's test where it is not only enough that some other doctor should say that this is a standard of care, it should be supported by evidence in literature. See, I have my doctor friend. You do something else. I also keep my scissors inside the uterus and suture. Not only he, I also do. So that doesn't become standard of care. So there should be some evidence also to show that, some literature evidence also show that is standard. So slowly, in Consumer Protection Court, it is going from Bolam to Bolito's test. So that is something which we have to keep in mind.
That means, in other words, the court is not listening to the expert witness alone. They will think independently and decide.
It is only a corroborative evidence. The court has to finally decide.
Yes, sir.
Sir, regarding the consent form you said, we cannot fill in the blanks. But most of the hospitals have pre-filled forms. So at the end, you said we should make them write in their own languages.
Yeah.
The last point, last line.
Yeah, actually, this is not foolproof, but it is better than a blanket consent. So you can ask them to write in their own language, I have read all these things and understood and give full consent. One line.
Okay.
If the patient cannot read and write, somebody has read it and I understand everything.
Because most of the consent, this line also is typed.
Yeah.
And they just sign it.
And
I think, you can't write the 2-3 pages. In VR surgery, we, in some places, we also take a 1-page consent that if oily food, it has to be removed, cataract comes, it has to be removed. Major things we explain. In their standard, they write, by standard write.
Is there a need for a second opinion in case of evisceration and enucleation?
Yes, 2 people should see better.
Which one?
Evisceration, no PLA, evisceration, enucleation.
Ideally, yeah.
Another thing is, you can take a video consent. See, the importance of video consent is one-night patient. So you call the relatives and the patient and you say that, do you consent to take a video consent? And should be recorded. Patient says yes. And then you explain everything to the patient. And you ask the patient whether you agree to all this and record it and give it to your, who are assistants so that it can be kept in a soft copy. One importance was that, I had a one-night patient who had an RD. He's an old man. So consent, everything written. Then I called the patient and talked. I said, what is your name? He said some name. He is around a very old man. Then I asked him, what is your age? He said, I'm 30 years old. So actually he was an Alzheimer's patient basically. He did not even know what he was saying. Now suppose you had taken a consent. Something happens tomorrow, he will go to court and say, who are you? He will say, I'm Abraham Lincoln. Then what is the point? So you're in big soup, no? So whenever you're in doubt, better you take a video consult. That gives you, some additional advantage over all this.
There is a small group whom we cannot take consent, like not conscious or coma or not comprehending what we are telling, and less than 12 years. So these cases you need a responsible guardian with 2 people.
And emergency cases, that doesn't apply for us. The patient
Emergency,
is not-
anything is possible.
without
Emergency,
consent,
without, like road traffic accident, somebody has given, come with a head injury and a
cannot wait for a
perforating
consent to
injury.
treat the patient.
You don't even know who is the patient. Everything, the police, you have to inform and then you can.
The most important thing in endophthalmitis cases is there was one case from Jipmer. Why they lost it was, it was not recorded that pre-op apidin was, or povidone iodine was not put for, it was not documented. So easily they could prove that all necessary precautions to prevent an endoph has not been taken. So that is enough to show. In fact, they got a favorable medical report from both LVP and SN saying that the doctor was right. But they could easily, he got an opinion from some other doctor who clearly said that povidone iodine has not been put. It is not recorded. So these are the important things,
In cataract surgery and all, the standard protocol, you can even keep it
Right, but they are
in the
putting or
OT
not.
notes and all.